Welcome to the Objective Recovery Podcast. Today we will discuss the challenges of living with complex chronic illness. I'm speaking with Mattheos Houlis, a holistic life coach who specializes in a condition involving chronic pain called Ehlers-Danlos Syndrome. Mattheos has lived experience with the condition and now helps his clients reclaim agency, develop sustainable habits, and navigate life with greater autonomy without minimizing the physical and emotional realities of the condition. Mattheos, I'm so interested in your story because many people who live with chronic illness have not only struggled with symptom management, but also developed issues related to pain management treatment. And patients are usually not educated about proper coping skills.
Well, thank you very much, Henrietta, for having me on. So Ehlers-Danlos Syndrome is a complex disorder and illness. It is a genetic and inherited disorder. There are 13 different subtypes of Ehlers-Danlos, and the hypermobility subtype is going to be the most common, but also going to be the most difficult to diagnose. The reason being is all those other subtypes actually have genetic markers that can be tested and detected, and therefore given a more concrete form of a diagnosis. But the hypermobile version, the classical version of Ehlers-Danlos syndrome, a clinical diagnosis has to be given based off of a observation and checklist from a trained physician.
So how did your story with it unfold?
I had a lot of illnesses as a child, from GI issues to dislocations and bone fractures and chronic pain, fatigue, just a lot of different explanations that couldn't be given at times as well. And Ehlers-Danlos syndrome, an issue with the body's collagen, okay? And the body's collagen is your connective tissue disorder. It's like the scaffolding, the framework, the rebar, so to speak, most of your organs, your muscles, your skin. So when you have, faulty collagen, the very framework of your body is, faulty. So you may look outwardly, very normal. You may appear very normal, but at the molecular level, at the microscopic level, you're very different from everybody else. So it affects neurologic body components, dermatologic body components, GI body components, and depending on the severity and the type of Ehlers-Danlos, it can also vary quite a bit. So with myself, I had a lot of GI issues when I was a young boy. I had a bowel obstruction that led to me being hospitalized for extended periods of time and requiring even to have some intestine removed when I was a boy. So it was just a complex and chronic type of illness where there was always something going on. It was hard to pin it down on something. And when I was then a teenager, around 16, I'd had several dislocations and, fractures by that time, but also different body changes from puberty that had occurred, weight changes, height changes. And when that occurs, you start to notice how you adapt differently to other people as well. So my mother had noticed some things, and when I had gone in to see an orthopedic doctor after a recent fracture, he had said, "Hey, have you ever heard of something called Ehlers-Danlos Syndrome?" I was like, what is that? And he's like, "Give me your hand. You have this party trick that you like to creep people out with, and if you'll allow me." That is the type of hyperlaxicity that I have in many of my joints. So the doctor was like, "Hey, let me see your hand. This is what's going on. I see this in people with Ehlers-Danlos. I'm not the specialist in that, but I do want to send you to a specialist that can more properly diagnose you if this is something that you have." So I saw, one of the leading specialists in Ehlers-Danlos syndrome, Dr. Bradley Tinkle, down at Children's Cincinnati in Ohio. He confirmed, that there was Ehlers-Danlos syndrome and what he believed to be my diagnosis. He then sent me for a consult to Dr. 𝗪𝗪, which was a physician that he trained with, who is also basically the world-renowned physician in Ehlers-Danlos syndrome. Dr. Dietz also concurred with Dr. Tinkle's initial diagnosis and said, "Yeah, you have Ehlers-Danlos syndrome." And at that time, I was also dealing with a lot of chronic neck pain and instability. I have, severe degeneration in my discs, and I was getting all these surgeons from Cincinnati Children's, Cleveland Clinic, Johns Hopkins, all of them concurring as well. Not only do you have Ehlers-Danlos syndrome, but we want to fuse your neck. We want to do a surgical procedure called an anterior discectomy and fusion, and we want to fuse the bone there. And I was only 16. They were suggesting the surgery, but they were also suggesting that I delay the procedure as much as possible because complications were almost a certainty at that time down the road. And to be that young to have that kind of a procedure was not something that they would have advocated. So pain management became a great hurdle that I had to deal with for a large portion of my life, and still to this day is something that I have to deal with on a daily basis. But it became very debilitating for a long period of time due to opioids being prescribed as a temporary Band-Aid. But that temporary Band-Aid is not something that is temporary at all. It's something that is bound to increase and be made worse. There's a lot of different complications that come with those medications being prescribed, and that's not something that they're meant to even be helping you with. So that was a big complication that added a great deal of torment and issues to my journey. And it's now gotten me to the point where I want to be able to assist other people with Ehlers-Danlos syndrome, patients with Ehlers-Danlos syndrome, so they're not, falling down that same type of a slippery slope. They're not confused about what doctors they need to talk to, and that they also feel like there's a community around them, so that they can continue to live a normal.
I would like to ask you a few questions in terms of the diagnosis and so what happened before. So you mentioned that it's a genetic condition. Was it known in your family? Was there anyone who had this disease? Could they help you at all?
That's a very good question. It is a genetic disease, and it is autosomal dominant. So that would mean that if you have a parent that has it, you have a 50% chance of passing it on to your child. So yes, I do have a parent that also has Ehlers-Danlos syndrome. And that parent was diagnosed pretty much at the same time that I was by the same physicians. These physicians, especially when diagnosing something like Ehlers-Danlos syndrome, they've been doing it for so long, and the type of criteria that they need, when they're looking at how much maybe your elbow hyperextends, how soft and velvety and buttery your skin is, other components of your medical history, as well as if your son is presenting with it and you just diagnosed your son, well, you probably have it. So if you're meeting all that criteria, so yeah, once you receive that diagnosis, especially like as a child, it's then obviously going to open up a lot of, okay, maybe that's why this was happening. Maybe that's why I had that as a child myself too. So yeah, so I do see family members that present as well. Now everybody is not going to necessarily present the exact same way. So it's not like because I have Ehlers-Danlos syndrome and a parent has Ehlers-Danlos syndrome, we both have like really bendy fingers. It's going to still present very differently. There's common components, but everybody is going to really just kind of present very differently.
So why would your parents or other family members not diagnosed earlier? Because there must have been a huge gap. So is it something that even doctors are just more aware of it these days, or there is just the science developed more?
I think that nowadays with social media, the internet in general, TV, daytime TV type shows like Dr. Oz, educational shows about, not necessarily oddities, I don't want to call myself or people an oddity, but podcasts even like this, people who are looking to educate people about things that are misdiagnosed or overlooked. This is something that is diagnosed in every 500 to 5,000 people. And the hypermobile version of Ehlers-Danlos or subtype of Ehlers-Danlos may even be more common. But it really is. It's very difficult to diagnose. And unless you have a specialist, that's really looking at you and doing a full workup to see if you meet that criteria, you may go your entire life You're just thinking, oh, that was just, you have clumsy moments, or, you're just a little bit more sensitive to pain, or you broke bones easier as a kid. I don't know what to tell you, There's sometimes maybe a medical and logical explanation. It could be Ehlers-Danlos.
Do they do a genetic testing these days to
They do. Most commonly through a skin biopsy is what they'll do. Now, as I stated, the subtype which is the most common, which is going to be the hypermobile classical subtype of Ehlers-Danlos syndrome, is the only one that currently does not show in any form of genetic testing that is currently available. You can eliminate many of the other more complex and sometimes dangerous forms of Ehlers-Danlos syndrome, like type 4. So type 4 Ehlers-Danlos syndrome is the vascular type of Ehlers-Danlos syndrome. So that is a very dangerous form of Ehlers-Danlos because you're not talking about the very structure of your blood vessels. So people with that disorder or syndrome of Ehlers-Danlos need to be worked up by a cardiologist very routinely. They need to be getting an echocardiogram at least every year to make sure there's no aortic dissection. So there's a greater deal of complications with certain subtypes of Ehlers-Danlos. So the genetic testing is beneficial to at least eliminate certain subtypes of Ehlers-Danlos, even if you do end up having the classical hypermobile.
So it's very diverse. And so what has been your treatment? You mentioned the pain medication. We will come back to that a bit later. But so in general, so I'm sure there is more to the treatment. So let's go.
Absolutely. So it's going to vary, again, based off of everybody's presentation and their symptoms and their needs. It's very important to have a good wellness routine, sticking to that as much as possible, and being understanding with yourself when you need to maybe go on the lighter version of that. Being able to kind of ramp down to a lower gear of yourself at times when you need to. But for myself, as far as treatments, I will say that there's currently no treatments or cure, I would say, available for any Ehlers-Danlos patient. That being said, there are certainly protocols that can be prescribed, as well as supplements that can be prescribed. So there's a great deal of research to indicate that high levels of supplementation with vitamin C can be very beneficial with the production of collagen protein synthesis. So the hypothesis there is that whether your body is creating maybe faulty collagen or not, another issue with Ehlers-Danlos is poor wound healing and poor healing in general due to that poor collagen matrix. So if you're able to increase, your collagen protein synthesis overall, you're then hoping to kind of bolster those areas or kind of reinforce that scaffolding as I was talking about. And by doing so, you're strengthening those areas and hoping to kind of just add more what's necessary. It's not going to, treat or cure anything. You're just really kind of hoping to add maybe a little bit more, even if it's not in the type of lattice you would want. So that way it's able to be more beneficial. Vitamin D, I would also supplement with on a daily basis as well. That's going to be anti-inflammatory and assist as well. That's what I do. A protein as well in the mornings. Creatine is something that I like to have in my diet, as well as hydration. You need to be hydrated when you have Ehlers-Danlos. Mast cell activation syndrome and POTS, or postural orthostatic hypertension, is something that is very common in Ehlers-Danlos syndrome. And dizziness, getting up brain fog is very common. So being able to stay hydrated is very, very important. Making sure that you have, like 8 glasses of water or water bottles for you prepared. I also like to use like a liquid IV or an electrolyte replacement at least every other day if I'm not having a little bit of salt, like maybe under my tongue in the morning to kind of boost my electrolytes. I also like to have just a little bit of caffeine now. It's something new that I've added to my diet in the mornings because it adds a little bit of pump to my step. But also I like to make sure that I'm getting enough sleep and rest because that's going to be the biggest thing because repair is everything. So making sure that you're repairing and getting that sleep and that rest is absolutely key.
Yeah, definitely. It sounds like it takes a very holistic approach. And so how about the mental health aspects? Because on this podcast, we talk a lot about mental health.
Yeah, absolutely. So there's a lot of aspects to Ehlers-Danlos syndrome that affect mental health. So the chronic pain in itself alone can be incredibly debilitating, and it affects your energy and your mood on a daily basis. The uncertainty of knowing, if tomorrow you're going to even have fatigue or pain to be able to go and do the activity you want, if you're going to be able to go on a date if you want, if you're going to be able to even go to the grocery store because you're in pain. So that affects your mood. The aspect also of many Ehlers-Danlos patients feeling isolated because they don't get believed quite often. There's a lot of medical gaslighting that can occur. They're seen as drug seekers a lot of times too, very frequently. Nowadays, we have less of a stigma with the diagnosis of like fibromyalgia. I think back, maybe a couple of years ago, fibromyalgia was actually a very heavily stigmatized medical illness.
Very mysterious, and many people, doctors, didn't believe.
Yeah, it was always something that it's in their head. They can't explain something or can't come up with it. It's fibromyalgia, but now it's something that's really kind of understood and it can be diagnosed, and there's compassion, and even at kind of a corporate level. That sounds weird to say, but I think you can understand what I mean by corporate level. So being able to have that kind of understanding with illness that is very commonly misdiagnosed, or it's unseen, or you're going into emergency rooms, you're looking kind of normal, but you're in pain. Maybe you dislocated your shoulder 3 times earlier that day, but it's back in the socket now, and there's no evidence of it having been an issue, but you're in a lot of pain. They think that you're going in there just asking for a shot of some form of a narcotic because you're in pain, but they don't believe you. You know what I mean? So you become a frequent flyer too. There's a lot of different aspects that people don't understand. The frustration, of being involved in it. The bills involved in it too. There's so many aspects of chronic illness. It's a full-time job. I read a statistic the other day that less than 25% of people with Ehlers-Danlos Syndrome are full-time employees, or are rather employed full-time. To understand that, there are a lot of people out there that need help with, some form of life coaching, some form of strategic plan or transition. That's what I'm looking to do.
And so how progressive is the condition, and what is the outlook usually, or is it varied depending on the patient?
It's a very good question. Very good question. So there's no advanced progression. It's not going to be like ALS or an MS or a lupus where you're going to expect, certain flare-ups or you to kind of decompensate over time. Now, that's not to say that, if you're an individual that, like myself, let's say, that has a lot of hypermobility in my hands and I have a lot of hand pain, when writing, that's not to say that I'm most likely going to be an elderly gentleman with more hand pain and arthritic type of hand pain than the person sitting next to me as a result. So there's certain common sense, I think, that would fall into that, as well as certain aspects could be predictable, like some joint replacements may be necessary after repeated dislocations, like a shoulder or a hip. It just really kind of depends on the damage that had been done. So it really kind of varies for each individual. The outlook is very good, though, depending on how early you get it diagnosed, the type of structure, the support structure that you have. If you have a family support structure, if you have a good primary care physician, good quarterback to really help you with the specialists needed, and your attitude. Your attitude with it is everything, and being kind of part of the community, I think, kind of helps. But you don't have a bad outlook. It's managing each symptom and each issue as they kind of present themselves.
So it's quite stable once it develops. It doesn't get very much.
Yeah.
So you spoke about the pain and the pain medication. So would you just say a few words about what challenges that involved for you dealing with pain and the medications?
Yeah, so you're prescribed pain medication, like an opioid pain medication, especially when surgical intervention is then also the end game. You know that the pain medication itself is not treating anything other than the instance of pain in that moment. Now, the pain medications that they prescribe are something that is toxic to your body. Your body has to adapt to them by building a tolerance. Now, when you build that tolerance, you naturally need more of that drug in order to satiate that same response. So that is the slippery slope in that cycle that you fall into. And over time, not only have you now, increased your dosage from, let's say, a standard dose of 5 milligrams to 30 milligrams, your body's anatomy and neurochemistry starts to change as well. Its nervous system starts to change as well. There's a thing called opioid-induced hyperalgesia. And what that is when your body literally starts to begin reacting to pain at an increased level than it would have prior to you having been on that pain medication. So not only do you now need more of the pain medication itself to treat the original pain because of tolerance, but you also need more of it due to the fact that you have potentially opioid-induced hyperalgesia, which is giving you not the illusion of increased pain or more pain, but it's making you feel as though you're in more pain. So it can be a slope where, you're now in this cycle of needing to be on medication that makes you sick if you get off of it. You're tied to a physician that is writing the prescription. You're not somebody that's using this in an illicit manner, using this in some form to, be recreational. You're using this even as prescribed, but it's something that quite literally can control your entire life depending on, how frequently you're using it and how dependent you may be. And it's not even a Band-Aid. It's really not even a Band-Aid. It is certainly something that is very beneficial for individuals post-surgery, but it is certainly not something that is beneficial for a daily chronic pain treatment.
Around the pain management, did you have any struggles with the doctors, or were you satisfied with your pain management?
I had a bit of it's an interesting question, actually. So I was satisfied at the time. The physician I was seeing was a full colonel in the United States Army, and he was fully comfortable with what he was prescribing, and he was advocating it, and and there was an extra level of trust, I think, in the level of professionalism that he was displaying, as well as perhaps the manner in which he was communicating. And that added perhaps, again, a level of confidence in what we were doing. But looking back, I certainly don't agree with how it had been handled then, and there was really no long-term game. I will say I met a very compassionate pain management doctor when I was living in the state of Arizona. And this physician, spoke with me, and I was like, listen, I'm not happy being on this stuff. It's not something that I want to be on. And I was like, listen, this isn't something where, again, I'm enjoying it. I'm looking to use it. I'm not even looking to escape with it. It's something that it's a problem that I recognize. So I'd like, some assistance in getting this stuff, out of my life. And he was very compassionate. He was like, okay, I'll tell you what, I'm going to help you step down off of it. And I think that if that is your attitude, and if that is your goal in mind, and that is your mindset, not going to have a problem with it at all. Okay. So that's what I did. And it was absolutely awful, but I did it, and I'm glad I did it. But I mean, it was absolutely still a experience that I wouldn't want to wish on my worst enemy, if I'm going to be honest with you. But it's still something that I needed to do. I'm glad I did it. And to be honest, it was something that created even a great deal of anxiety later in life for me and avoidance, because I knew that if I ever needed to go and have some type of a surgical procedure, or if I needed to, go to the hospital because I broke an arm or something like that, and I needed to be given some form of medication, so I just don't want that to even be a part of my future story anymore. It's just, that was such a bad and dark time for me that I just don't want it to have any kind of resonance with who I am today, even if it is something that I feel I can control and I have a support structure to help me with.
Yeah, I'm so happy that you resolved it. So are you more satisfied with your pain management regimen now that you're using?
Yeah, I mean, I use much more natural types of medicines and anti-inflammatories and supplementation with vitamins and minerals. I'm very diligent about exercise and kind of the physical training of my body, making sure that I am listening to it as well, and I'm basically doing just PT, on each joint the same way that I would be if I was with a physical therapist, because it's a use it or lose it type of a disorder for sure. You could say that about anybody in their life right now, but if you're talking about keeping joints stable with a hypermobile type of a disorder, this is something that you need to be working on consistently. So that's something that I need to make sure I'm always doing.
So what do they, when you seek pain management, is the opioids usually the only option that the doctors bring up, or they have they offer different options they discuss with you and the risks and benefits?
Yeah, no, that's a great question. And I would say I'm pleased to say that most physicians nowadays are not necessarily pushing opioids the same way that they were, several years ago. There's been a huge culture shift in the physician, because it was a problem created, yes, by the pharmaceutical company, I'll say that, but also by physicians that were writing it and overprescribing. So the crackdown, by the FDA, by the DEA, as well as common sense by physicians, I think have really kind of curbed that quite a bit, because they saw what the opioid crisis turned into. So nowadays, it's not the first line, I think, that gets prescribed. Physical therapy for sure is, more holistic type of options. Medical marijuana is something that gets, advocated, pretty frequently for Ehlers-Danlos patients now as well. And that's something that is, very readily available in many states with a prescription. So many physicians will, advocate that as well. A support system for sure is something that can be very beneficial. Working with somebody like myself that's a life coach, even if it's to check in, once a week, and say, hey, what's going on? Because that's the other thing. You can work with a therapist about a lot of your other stuff, but how many therapists you're going to work with have the same type of disorder or syndrome that you have, that you can really kind of build that rapport with as well. So I'm looking to have that community aspect of I get it. I get it. So there's a lot of different options they can have to prescribe to you now, prior to just saying, here you go, here's a opioid, or here's a surgical intervention that may make things worse.
So you mentioned that you are helping others now to manage this condition as a coach. So just share a bit about that. What does that involve, and how do people seek you out in the first place? Because we discussed that even getting a diagnosis can be difficult. So what is usually the process?
Yeah. I've had a great deal of experience over the last several years helping young adults with cognitive, behavioral, and developmental disabilities, not only with fitness, but also with, job coaching, transitional job coaching. So being able to provide that same type of a service to, patients with Ehlers-Danlos Syndrome is what I'm really looking to provide, especially after they may have just received a formal diagnosis. If they're working with a physician and they just received a diagnosis and they're Googling and they're trying to find somebody that they can help, that's one way they can find me. Physicians that I'm partnered with may be able to, give my name and they can find me that way as well. I have a website that they can find me. I'm always posting content now too. So if you just got diagnosed and you've been working, 50-hour weeks, maybe that's not what you need to be doing anymore. And immediately resigning your job isn't a good idea for anybody to do, right? So you start working with me. We kind of sit down first. Okay, what do you like? We're not scrambling for a job right now because you just lost one. You got one. Let's figure out how we can maybe take a step back, maybe do a career change, start applying for certain things. Maybe it's applying to school if that's something that you're interested in. Anything that could help really build the life of design that is still going to give them the freedom they want, but now around the diagnosis that they got.
And then lifestyle, you also work with the clients on lifestyle.
Lifestyle, yes. So making sure that they understand that it's not meant to be debilitating or a disability that takes you out of normal life. Just because you shouldn't be playing in a contact sport and be swimming instead doesn't mean that okay, you can't be going to hockey games in the stands, but you can sign up maybe for a relay race at the YMCA in the pool. Just still understand that you're changing your perspective and your mindset about what you can be doing on a daily basis. I can hold you accountable in a good way. I can hold you accountable, without judgment, because I understand if you have Ehlers-Danlos, it's already natural for you to want to show up when talking to me because you're like, okay, well, this guy already knows, he has it too. He's kind of doing it. He's a coach. It's difficult for you to kind of tell me to go jump in a lake as if I don't get it, because you especially if you've been a patient that's been, medically gaslit, or you've been dealing with doctors that have not been really listening to you. If you're now finally working with a coach that actually understands, not just because they read about, the condition in a book, but they actually have experienced it. They've also experienced the same waiting rooms that you have. They've experienced the same frustration, the medical bills, the 2 hours until you get to the doctor's office. Just all of the nuance I get, so there's that as well. So being able to work together in a short term or a long term is absolutely something that I have no problem being able to do.
Is it individual or groups?
I'm able to provide both. So one-on-one is where we get into the nitty-gritty, but the community-based offerings that I have is something that you'd be also involved in. So you can opt out if you'd like, but I would prefer for people to be able to be a part of the community that I'm looking to build.
So again, what is the website to find you?
Yes, you can go to coachprometheus.com.
Maybe I'll put this in the description. I'm also curious in terms of the future. I'm always interested in innovation. That's what my career has focused on in many ways. And so are you aware of any new developments for Ehlers-Danlos syndrome to manage pain management systems that don't actually involve any medication, but more like brain stimulation devices, things like that, or anything else?
Yeah, absolutely. There's definitely research to indicate that there's some benefit to some muscle stimulation around different nerves, for muscle soreness as well as, nerve pain. For myself, for example, when I was having some severe pain, what they were recommending to do as a pain management option would be to go in and you try to first identify the nerve by using a local anesthetic. So you use that local anesthetic first by kind of numbing that nerve, and you then kind of wait to see, does that affect the pain in any way? Does that make it improve? And if it does improve, then you can say logically, okay, that's the nerve that's affected because we just numbed it, it's improved. Now what we're going to do in there is we're going to go in there and electrically, cauterize that nerve and destroy it, so that way it's not there anymore and giving you that pain. So that's one option that they can do. Now, I will say that not every Ehlers-Danlos patient may be a good candidate for that, and many doctors may not necessarily advocate. Now, again, with Ehlers-Danlos patient, poor wound healing is absolutely something that is a part of the disorder. When you do ablate any kind of a nerve, it does grow back. It grows back, whether you have Ehlers-Danlos syndrome or not. So, with Ehlers-Danlos syndrome, there's no saying whether or not that nerve comes back a little bit angrier, so to speak. So that pain could actually, when that nerve grows back, ends up being a little bit worse. And then it may be a little bit harder to treat that area. So that is one complication that can arise.
In terms of new treatments, I guess I'm very interested in genetic treatments. Just treating the root cause if possible. Yeah. I imagine that in this case, since it's a it's multiple genes involved, it's not easy to design such a gene therapy.
So there had been some genetic research done in manipulating and altering the genes, I believe with stem cell therapy, that had been done at either Cleveland Clinic or Johns Hopkins Hospital. And from what I understand and remember, a test subject did not survive the trial, and as a result, they ended it. So that is obviously a very poor outcome, to say the very least, and that's not something that I would want to be in a study, for people with Ehlers-Danlos syndrome. So it's kind of a back to the drawing board. So genetically, I think that we've seen a great deal of advancements in CRISPR technology, as well as different mRNA type of alterations over the last several years. I'm somebody that is still needing a lot of data before I would trust something like that on myself. But that's not to say that as I sit here on the podcast, do I have a great deal of hope for some form of a treatment for Ehlers-Danlos, or at least one of the 13 subtypes? Absolutely.
Probably one thing that limits the clinical trials as well is that you mentioned that it's progressive, but it's not getting much worse. So it's not like people become terminal very soon, and then of course the targeting multiple genes. That's never easy. The
funding as well. So it's been very similar to other genetic disorders. So a lot of times it ends up getting kind of funded into that same research. Disorders like Marfan syndrome and osteogenesis imperfecta, also known as brittle bone disease. Those are usually two other genetic disorders that are very commonly researched in that same type of a category, or usually by the same geneticists.
I'm very interested in genetics also because it's actually my original background. So my PhD was it's part of it was genetics. So in this case, maybe another approach that I'm sure that people are working on is not the genetic level, like manipulating the DNA, because again, it's hard, multiple genes, but epigenetics. So are you familiar with that?
Yes.
If anything like that?
Yes. Yeah.
That's actually my long-term like expertise in many different fields.
That'd be interesting. Yeah. So as of right now, you can work with a genetic counselor. If you're looking to have children. Obviously, myself as being somebody who has Ehlers-Danlos Syndrome, I have a 50% chance of passing that on to a child. As far as treatment for long-term the population, right now that would be the only counseling or type of treatment that can be given for the prevention of Ehlers-Danlos Syndrome. But as of right now, treatment and prevention, that's all we have.
So there is no effective way to prevent, let's say, in a family now that doctors are more aware and they can. I'm sure that there are more parents now who are than a family with the awareness that it might get passed on, especially if it's it's a dominant genetic inheritance. And so, is there anything that can be planned ahead of time?
Now, I don't know if there's any current testing ability for any kind of preterm. I don't know if like an amniocentesis would be showing of an Ehlers-Danlos genetic marker. I've not done research into that, to be honest with you, to be able to give you an answer on that. That's a good one that I actually do want to look into, though. Yeah, no, other than planning for the event of it being perhaps a more difficult pregnancy, which is also sometimes very common with Ehlers-Danlos patients. So that's something that you can, again, during that genetic testing, kind of prepare yourself for as the mother. So again, it's about managing symptoms as they present themselves.
The prenatal diagnosis is also difficult in terms of the ethics associated because, testing is available for more.
Exactly.
They can take samples, but there is whether the ethics field concerns that.
Exactly.
The epigenetic approach, I like that potentially because that can be something that many, for example, there are medications like chemicals that have epigenetic effects. Epigenetic means it won't change the DNA sequence that got inherited, but it can change how the gene functions and how that is expressed, when it's expressed, which cell type, which developmental phase, and so on. Pharmaceuticals like that could target multiple genes at the same time. If they can manage, figure out something like that. It's hard to make it specific because, if there are non-specific effects, but maybe in the future that can also, now there are the research attempts to actually also target epigenetic therapies, similarly to like CRISPR that you mentioned, where the genes, target specific genes, but instead on the epigenetic level. So thank you very much. This has been very enlightening, and you definitely know your thing, so it's I'm very sure that your clients really benefit a lot because we talked about the science. You are very familiar with all many different parts of this challenge.
It was a pleasure being here, and if you need some help planning your next strategy, if you're an Ehlers-Danlos patient and you're looking for some assistance, I'm absolutely here to help you out.